Good morning friends, welcome to my channel. So today we are going to discuss about the temporal bone and its parts. Now we are going to discuss about the muscles and structures which are present related to the temporal bone. Now coming to the temporal bone, we have different parts in the temporal bone. One is, let me show you on the skull. So here we have two skulls. So in this colored skull, I can show you clearly all the parts of the temporal bone. So the parts of temporal bone are, one is squamous part, then you can identify a foramen which is outside. This part is called as tympanic part. Then behind this we can identify the mastoid part, and inside part is petrous part. And we can also identify a projection, bony projection called as styloid process. Most of the bones, as the styloid process is an elongated bony process, most of the times it may be broken. So we may not identify, sometimes we may not identify clearly the bony process, the styloid process. So styloid process is also a part of the temporal bone. Here we have squamous part. In the individual bone I am showing you now, squamous part, tympanic part, then the styloid part. You can identify the mastoid part over here, and then inside part is petrous part of temporal bone. Now coming to the squamous part of temporal bone, the parts of the squamous part, the borders and surface of the squamous part of temporal bone are, one is anterior-inferior border. So this is a left-sided temporal bone. How to identify is, try to see the zygomatic arch. It has to present outside. Then you can identify this petrous part of temporal bone. It has to project anteromedially. Okay, so it has to project anteromedially. So if you hold it in wrong position, entire the process also they will become upside down. So try to hold this bone in anatomical position. To hold this, try to keep the zygomatic arch. It has to project anteriorly, and the petrous part of temporal bone, apex of the petrous part of temporal bone, it has to project anteromedially. That is the position, anatomical position of the temporal bone. Now coming to the squamous part, it is having antero-inferior border. Okay, so you can identify antero-inferior border. Entire this border is antero-inferior border. Then we can identify the superior border. This is superior border, and it has two surfaces. One is external surface. Then we can identify the internal surface. Okay, so in the bone you can identify here external surface. Then inside part is internal surface. Okay, so that is about the borders and surfaces. Coming to the external surface of the squamous part of temporal bone, we have, it's a floor. This part, the external surface, is forming the floor of temporal fossa or temporal region, so which gives origin to the temporalis muscle. Where we can identify a groove just below this external surface. This groove is passing middle temporal artery. Then we can identify, behind this we can identify a crest. Yes, in this skull I am showing you now. So here we can identify external surface, and there is a groove for middle temporal artery. Below this groove for middle temporal artery we can identify a crest. So this crest is called as it is a temporal crest or supramastoid crest. Okay, supramastoid crest. So this supramastoid crest, which gives attachment to the temporalis fascia. And below this crest, we can identify the mastoid crest we can identify. Below the crest we can identify a suture called as squamomastoid suture. Squamomastoid suture means between the squamous part and the mastoid part, you can identify a suture called as squamomastoid suture. Let me show you on this uncolored skull to identify clearly the squamous part, and this is the mastoid part. This suture is called as squamomastoid suture. To remember the structures present at the external surface, one is the floor of temporal fossa, groove for middle temporal artery, then supramastoid crest. Below the crest you can identify the suture called as squamomastoid suture. So towards anteriorly we can identify the roof. This roof is over the external acoustic meatus. Roof over the external acoustic meatus. This also we can identify on the external surface. And also we can identify a triangle over here called as suprameatal triangle. So here you can identify the crest. supramastoid crest. It is forming the upper boundary of the suprameatal triangle. Lower boundary which is extending from the supramastoid crest and extending down and reaches to the posterior border of tympanic part of temporal bone. And then the base is formed by the superior border of the tympanic part of temporal bone. So this part is called as suprameatal triangle. If we just go through this triangle 12 mm, we can enter into the mastoid air cells. So here we have separated the temporal bone to see clearly how the structures are present. Yeah, here you can see that. Excuse me. Yes. So here we have a separate temporal bone. So here you can identify the suprameatal triangle. If we just go through this suprameatal triangle, we can enter into this mastoid air cells. So 12 mm deep, we can identify, in the 12 mm deep, we can see the mastoid air cells. We can enter into the mastoid antrum. This is nothing but the mastoid antrum. So now we have seen the supramastoid crest, suprameatal triangle, and then we can identify the squamo-mastoid suture. Now we are going to discuss about another feature which is present on the external surface, that is called as zygomatic arch. So this zygomatic arch, how it is formed is, it is formed by the zygomatic process of temporal bone. So this zygomatic process of the temporal bone which is extending, you can see here clearly. So the zygomatic process which is extending anteriorly, and then it is going to fuse with the temporal process of the zygomatic bone and completes the zygomatic arch. So what are the structures we can identify on the zygomatic arch? Or one, we can identify a concave superior surface. Concave surface, you can feel the surface here. So this is a concave surface present above. Then we can identify, below that we can identify the mandibular fossa. So I will show you clearly here. So the concave surface above, then below is the mandibular fossa. Yeah, here you can see clearly, this is nothing but the mandibular fossa. So I have separated the zygomatic arch over here. So we can identify concave surface above, below is the mandibular fossa. So what is the structure present here at the concave upper surface is tendon of temporalis. Tendon of temporalis, which is present at the level of this concave upper surface of zygomatic arch. And what about the lower surface? Lower surface is called as mandibular fossa. This mandibular fossa, it has having two parts, articular part and the non-articular part. Articular part anteriorly, posteriorly non-articular part. Now before going to see the articular and non-articular, we must understand the two roots of the zygomatic arch and the mandibular fossa. What are the two roots? What are the two roots of this mandibular fossa? So anterior to this mandibular fossa, we can identify a root called as anterior root, and then behind you can identify the posterior root. This is anterior root. Let me show you clearly. So in the anatomical position I am holding you now. So here you can see the anterior root, and behind this is the posterior root. Anterior and the posterior. Now I am turning down and try to show you what is present at the anterior root. So at the anterior root, below this we can identify a tubercle called as articular tubercle. And the posterior root, let me show you this posterior root. Posterior root, what happens is, it is continuous with the crest. What is that crest? Called as supramastoid crest. Yeah, here you can see. So this is anterior root. So this is anterior root, and here is the posterior root. Now I am just turning it laterally and try to show you the posterior root is continuous with the supramastoid crest. You can see clearly over here also. Okay, so that is nothing but the anterior root and the posterior root. So this posterior root, anterior and the posterior part, anterior which is extending upwards and continuous with the superior border of the zygomatic arch, whereas the posterior root which is extending back and continuous with the supramastoid crest. Okay, supramastoid crest. So coming to the posterior root lower part, lower border of the posterior root is is arched. Here you can identify this is arched and forms a rudimentary tubercle called as postglenoid tubercle. So I'll try to show you here. Yes. So below this posterior root we can identify it is arched and it is extending down and forms a rudimentary tubercle. So this tubercle, which is very prominent in the quadrupeds. So why that bony process or postglenoid tubercle is most prominent in the quadrupeds is it prevents the dislocation of the temporomandibular joint. It prevents the dislocation of temporomandibular joint. I will try to show you in another skull. Yes, in this skull you can identify the postglenoid tubercle little prominent. Okay, so this is very prominent and elongated in the case of quadrupeds to prevent dislocation of the temporomandibular joint during their mastication process. Now coming to the zygomatic arch attachments. So it is having superior border and the inferior border. So the superior border which gives attachment to temporal fascia, the temporal fascia which is extending down from the superior temporal line and it is descending down and reaching to the superior border of the zygomatic arch, where it is going to split into two layers. That temporal fascia, outside to the temporal fascia, the third layer of the scalp, gallia ponioretica, which is extending down and reaches to the superior border of the zygomatic arch, whereas the inferior border of the zygomatic arch, which gives attachment to masseter muscle. Now coming to the mandibular fossa. So the mandibular fossa, it is having anteriorly articular part and posteriorly non-articular part. Anteriorly articular part and posteriorly non-articular part. So anterior articular part, it comes under the squamous part of the temporal bone, whereas posterior non-articular part, it comes under the tympanic part of the temporal bone. Okay, let me show you clearly from the lateral aspect. Yes, here you can identify anteriorly articular part and posteriorly non-articular part. So here we have two parts in the mandibular fossa, two sutures we can identify anteriorly and the posteriorly. So the anterior suture is called as squamotympanic suture, and posteriorly we can identify petrotympanic suture. Anteriorly squamotympanic, posteriorly petrotympanic suture, and again it is extending anteriorly, and this suture is called as petrosquamous suture. So in this skull I will try to show you here. So approximately it is present along this line, petrosquamous suture. So here anteriorly squamotympanic, posteriorly petrotympanic suture. Okay. Now when the articular part which is giving, it is going to articulate with the condylar process of the mandible. Here I have just fixed the mandible to show you how the condylar process of the mandible is articulating with the mandibular fossa of the temporal bone. Let me turn it laterally and show you clearly how the articular part is going to articulate with the condylar process of the mandible. This is called as articular part. Posterior part, which you are seeing now, this part is called as non-articular part. And these sutures, when coming to the sutures, I have told you two sutures. One is anteriorly we can identify the squamotympanic suture, and posteriorly I told you petrotympanic suture. Coming to the petrotympanic suture, medially it is related with the three structures. One is anterior tympanic artery, which is a branch of first part of the maxillary artery. Then the nerve is cardia tympani, which is present medially. Most medially is cardia tympani, then anterior tympanic artery, then lateral to the anterior tympanic artery we can identify the anterior ligament of Malleus. So this anterior ligament of Malleus we have discussed in the norma basalis, which is going to fuse with the spine of the sphenoid. Here you can identify the spine of the sphenoid. So this ligament which is extending down from this petrotympanic suture and the spine of the sphenoid, and it is descending down and reaches to the lingula of mandible. Here you can identify the lingula. Up to this lingula, the ligament which is extending. That ligament is called as sphenomandibular, and the anterior ligament of Malleus, which is extending from this medial part of the petrotympanic suture and then reaches to the Malleus. And coming to this articulation point, TMJ, temporomandibular joint, between the condylar process of the mandible and the mandibular fossa, we can identify the articular disc is present. This disc is separating the cavity into two compartments, superior compartment and the inferior compartment. Means above the disc is called as a menisco. Above the disc is called as meniscotemporal compartment. Meniscotemporal compartment. Below the disc it is called as meniscocondylar compartment. Meniscocondylar or meniscomandibular compartment. So the disc which is present between the condylar process of the mandible and the mandibular fossa. So that is about the articular disc which is present between condylar process of the mandible and the mandibular fossa. So that is regarding the external surface of the squamous part of temporal bone. Now coming to the internal surface of the squamous part of temporal bone. Coming to the internal surface, we can identify some depressions over here. So these depressions are formed by the gyri of the temporal lobe of the brain. So you want to see in this uncolored skull, you can see clearly. So these are the depressions which have been formed by the gyri of the temporal lobe. And we can identify in this individual bone, you can identify some grooves. These grooves are formed by the middle meningeal vessels. So middle meningeal artery, which enters into the cranial cavity through the foramen spinosum and enters into the middle cranial fossa, and then it extends upwards at the middle part of the zygomatic arch. It is going to divide into two branches, anterior and the posterior. So the anterior branch of middle meningeal artery, which is present at the level of the pterion, whereas the posterior branch, which is extending posteriorly and reaches to the level of supramastoid crest. Okay, so the posterior branch of middle meningeal artery, which is extending up to the supramastoid crest and supplies to the dura. You can identify the grooves clearly over here. Okay, this is a groove for the posterior branch of middle meningeal artery, and this is a groove for anterior branch of middle meningeal artery. And coming to the superior border of the squamous part of temporal bone, which is going to articulate with the parietal bones. Here I can show you. So the squamous part, superior border, which is going to articulate with the parietal bone. Okay, and then coming to the antero-inferior border. Let me show you this antero-inferior border. So this antero-inferior border, which is going to articulate with the greater wing of sphenoid bone. So coming to the next part is the mastoid part of temporal bone. Mastoid part of temporal bone, it is having external surface, and then we can identify the internal surface, inside part. Okay, external surface and then internal surface inside the posterior cranial fossa. And it is having superior border. You can see the superior border over here, and then you can identify the posterior border. This is the posterior border. Superior border, posterior border, external surface, and inside it is internal surface. Okay. Then coming to the attachments. So this conical bony projection, which we can call it as the mastoid process. So this mastoid process, at birth you cannot identify this mastoid process. When the baby rotates his head laterally, then the sternocleidomastoid muscle pulls the bony part, mastoid part, downwards, and results in the formation of this mastoid process of the temporal bone. Whereas the muscle attachments, this mastoid process which gives insertion to the sternocleidomastoid muscle, and then splenius capitis, longissimus capitis, and then we can identify a suture between the squamous part and the mastoid part called as squamomastoid junction, squamomastoid suture, and where we can identify the occipital belly of occipitofrontalis, the muzzle of the scalp, which we can identify, and also the auricularis posterior, which is present at the level of squamomastoid junction. And in some bones, you may identify a foramen called as mastoid foramen. mastoid foramen. Try to show you the mastoid foramen over here. Yes. Yeah, here you can identify the mastoid foramen on the external surface. So close to the occipitomastoid suture. So this we can identify occipitomastoid suture. Close to the occipitomastoid suture, you may identify a foramen called as mastoid foramen. Mastoid foramen. Okay, which passing the emissary vein, and this emissary vein drains into the sigmoid sinus, sigmoid venous sinus. Okay, and other structures which are present at the level of this external surface are, so the posterior auricular vein, are also called as, and meningeal branch of occipital artery. These are all the structures present externally. And internally, coming to the internal surface of the mastoid process of the temporal bone, what we can identify are, we can identify a groove. This groove is for sigmoid venous sinus. So in the uncolored skull, I'll try to show you. Yes, here you can identify the groove for sigmoid venous sinus. So this sigmoid venous sinus, which is present at the level of internal surface of mastoid process of the temporal bone. So inside the mastoid part, we can identify the air cells. Inside the mastoid part, you can identify the air cells. So here I have separated the temporal bone. So to show you clearly the mastoid air cells. These are all nothing but the mastoid air cells and the mastoid antrum. So when you go 12 mm deep to the supramastoid and suprameatal triangle, you will enter into this mastoid antrum. Coming to the two borders, one is superior border and the posterior border. Superior border, it is going to articulate with the squamous part of parietal bone, and the posterior border, which is going to articulate with the squamous part of occipital bone. And here sometimes you may identify the lateral angle to the jugular process. That what is jugular process we will explain you in the next class. Thank you so much, guys. So the rest of the parts, petrous part of temporal bone I am going to explain you in the next class, and the tympanic part also I am going to explain you in the next class. Thank you.